to my webinar, Photobiomodulation. What we're going to cover is what is methylene blue? How does it work? What conditions does it help? What happens with a combination with transcranial photobiomodulation? What is a safe and effective dose? And what's the best product? This is a paper from 2012 by Francisco Gonzalez Lima, whose name will come up very frequently, in neurometabolic mechanisms for memory enhancement and neuroprotection, methylene blue. That's just methylene blue and this provides the first view of the memory enhancing and neuroprotective metabolic of action of methylene blue in vitro. These mechanisms have an important implication as a new neurobiological approach to normal memory and memory impairment and neurodegeneration associated with mitochondrial dysfunction. Methylene blue action is unique because its neurobiologic effects are not determined by regular drug receptor interactions with drug response paradigms. Methylene blue shows a hormetic dose response with the opposite effect at low and high doses. At low doses, methylene blue is an electron cycle in the mitochondrial electron transport chain with unparalleled antioxidant and cell restoration enhancing properties that affect the functions of the nervous system in a versatile way. A hormetic change means that you'll have a biological effect as the dose increases. If you keep increasing the dose, then you're going to have a negative effect. And we know that the hormetic balance of methylene blue's dose response is between 1 and 4 milligrams per kilogram and is ineffective at 10 milligrams per kilogram. The memory enhancement effects associated with improved memory consolidating in a network-specific and useful fashion. In addition, low doses of methylene blue have also been used for neuroprotection against mitochondrial dysfunction in humans and experimental models of disease. The unique auto-oxidizing properties of methylene blue and its pleiotropic effects on a number of tissue oxidases explains its potent neuroprotective effects at low doses. The evidence supported mechanistic role of low-dose methylene blue as a promising and safe intervention for improving memory and for the acute and chronic conditions characterized by increased oxidative stress, neurodegeneration, and impairment. Methylene blue is an FDA grandfathered inexpensive drug that has been used safely in humans for over 120 years. Indeed, methylene blue was the first synthetic chemical used therapeutically in humans. Pharmaceutical grade USP purity methylene blue is available in every emergency room in the United States. Its use does not extend to neuroprotection or enhancement. Low dose, that's 4 milligrams per kilogram. In my case, it would be around between 70 and 280 milligrams of methylene blue currently has many human applications, including various metabolic poisonings such as methylmemoglobinemia, cyanide poisoning, and toxic encephalopathy. In a similar way as methylene blue compensates for cytochrome oxidase inhibition for poisons, methylene also improves memory retention in conditions characterized by impaired oxidative energy metabolism. You can see that its main effect is in the mitochondria as a high affinity straight to the nervous system. And in a healthy mitochondrial cell, it produces lots of energy and few harmful free radicals. But in an unhealthy mitochondrial cell, it produces little energy and produces lots of harmful free radicals. And that essentially kills the cell and everything around it. So methylene blue and photobiomodulation equals more energy, neuroprotection. Explain it this way. So we're going to look at the mitochondria. So there's two layers, the outer layer here in pink and the inner layer in orange. And this is what the diagram is showing it. Outer layer and the inner layer. And most of the action is going to happen right across that orange inner layer. I'm going to explain to you this. So this is how the electrons are pushed down this in and outer layer there so that it can generate ATP. Let me explain to you this way. So it's pushed across with methylene blue. It's pushed across with methylene blue. So you have a lot of hydrogen on the outside inner in that little space. And then it's moving back into more. If you have less oxygen, you're going to have less hydrogen going across, less ATP. And neuroinflammation is one of the ways that shows up with less oxygen or more inflammation. So this is a mouse model using methylene. It's very interesting because this is therapeutic benefits of methylene blue on cognitive impairment during chronic cerebral perfusion. And let's take a look at it. This again, just methylene blue. What they're going to do is they're going to take a mouse and they're going to ligate or close off the carotid arteries up to the brain. And you can see this blue area is the area of hyperperfusion. And what they're going to do then is they're going to show you what happens here. So chronic cerebral hyperperfusion, a risk factor for mild cognitive and Alzheimer's disease, affects mitochondrial respiration and consolidation. Therefore, drugs that improve mitochondrial function may be appropriate cognitive treatments for cerebral hyperperfusion. Methylene crosses the blood-brain barrier and at low doses serves as an electron cycle in the mitochondrial electron transport chain. Previous studies implemented methylene blue in both memory enhancement and neuroprotection in rats that underwent permanent bilateral carotid occlusion or sham surgery. They gave them a high dose of 4 milligrams per kilogram of pharmaceutical grade methylene or safe for 1 month. These animals went through a battery of tests like field of vision, water-based odor recognition tests. And the B2O or the carotid occlusion rat showed worse performance in the visual water task without showing differences in their motor ability, visual guided swimming, or odor recognition. Alay, methylene blue, reduced deficits in visual learning and memory that resulted from cerebral vascular insufficiency, while the carotid artery hyperperfusion animals took longer to learn each problem and showed lower performance in challenge throws. Animals that received daily post-session methylene blue performed significantly better than saline-treated subjects, both during training and during growth. This is the first study to demonstrate learning deficits caused by carotid occlusion. Results suggest that methylene blue benefits conditions involving cerebral, chronic cerebral, such as mild cognitive impairment, vascular dementia, and Alzheimer's disease. Methylene blue, an auto-oxidizable mechanism, are ideal for targeting neural tissue oxidation. After administration, methylene blue passes through the blood-brain barrier and accumulates in the human brain. Methylene blue is relatively small lipophilic compound, so it's readily into the role of mitochondria. At low doses, methylene blue enhances electrical flow, mitochondrial respiratory chain, thereby stimulates mitochondrial cytochrome oxidase metabolism and oxidation. Makes place oxygen as an oxidant in toxic or low conditions. Moreover, low dose methylene displays potent antioxidant effects, where low dose methylene blue prevents superoxide free radical formation during fusion. We've also shown that it decreases free radicals induced lipid. Show you low dose methylene blue successfully in vivo as an artificial donor electrons to the mitochondrial electron transport chain in its form, thus increasing cytochrome oxidase activity in brain oxygen consumption. Because methylene proved effective in enhancing memory in a large number of experimental paradigms, teams hypothesized it could also effectively attenuate memory deficits nested models of cerebral. Therefore, our thought was to investigate whether chronic administration of methylene could be used. Learning and memory is caused by chronic fusion. This low dose of 4 milligrams, 4 milligrams per gram of blue was selected based on findings that methylene retention in various tasks, and that doses above below this are medically behaviorally ineffective. The beneficial effects of chronic low-dose methylene blue is caused by cerebral fusion principle and the base possible development of early effective mild Alzheimer's disease. This also shows translational value in other the studies of new neurometabolic. That's like, despite compelling evidence of the role of chronic brain food pathology, mild and Alzheimer's, animal models that this metabolic deficit used before to test rate enhancing prevention target. Present study is the first one to demonstrate low dose methylene blue has initial animal model of chronic brain hypertension. Study serves concept to test the efficacy of chronic metabolic intervention with low dose methylene relevant to mild impairment in Alzheimer's disease. Thus, if interventions affect human clinical trials, chronic low dose methylene accomplish with a relatively inexpensive and non-invasive means. Adverse reactions to methylene blue have only observed doses much larger than our range or non-pharmaceutical chemical grade methylene blue that contains toxic impurities not found in pure used methylene ability to target cytochrome oxidase, neuronal energy metabolism at the mitochondrial level provides us with a novel new learning use deficits. This is another article in 2020 by my co-authors, Salabor. This is photobiomodulation. Effects of transcranial photobiomodulation and methylene blue on biochemical behavioral profiles of mice model. The effectiveness of transcranial photobiomodulation and methylene blue learning and memory impairment is previously reported. In this study, we investigated the effects of transcranial photobiomodulation and methylene blue in combination or alone on chronic mild stress-induced learning and memory impairments in mice. So if you stress a mouse, it's going to be difficult to learn. And so that they stress the mouse, and then they get both in combination or alone, methylene blue. Behavioral tests revealed that chronic mild stress impaired learning with methylene photobiomodulation and their combination reversed these. This was observed affirmation molecular analysis caused by this stress. But it was compared with control levels. Both transcranial photobiomodulation and methylene blue in combination or alone has some effects on learning in these stress. From control to photobiomodulation and methylene blue, that's very high change, actually better controls when you're these two tests. Another mouse model, methylene blue photobiomodulation, cover cognitive impairment in hepatic encephalopathy. There are different effects on cytochrome oxidation. Now, hepatic encephalopathy, a brain disorder caused by liver, occurs when the liver is unable to properly filter toxins in blood, leading to buildup of these substances, ammonia, which can then travel to the brain and dysfunction. This condition can result in a wide range of neuropsychiatric symptoms, from mild personality changes to severe consciousness and even coma. Neuroinflammation is a key player in the development of progression of encephalopathy. So see this? Toxins in the body build up, pass to the brain, and becomes overwhelmed. This is a differential mechanism of biomodulation. Methylene Blue, which is photobiomodulation, directly stimulates cytochrome C oxidase, CCO, right? That's cool. It facilitates the catalyst, producing an increase in holoenzyme. Methylene Blue acts as an exogenous electron shuttle. It accepts electrons and transfers them to cytochrome C oxidase. So here's a little model of it's pushing more of these electrons over that photobiomodulation assists in pushing more ATPs, more energy, more neuronal energy, means brain fatigue. In summary, the study identified the neuroprotection functional improvement effects of methylene blue and photobiomodulation. Hepatic encephalopathy induced cognitive dysfunction that overwhelms the dysfunction. Demonstrated that although both treatments could affect the learning deficits in HE, there's a different effect of CCO on CCO activity. Our findings can be supported previous findings showing PBM regulation of the CCO, not other complexes. It's not as effective as methylene blue in this in HE, hepatic encephalopathy, whereas methylene blue is able to bypass HE mitochondrial damage to other complexes, sending electrons directly to CCO, which is so important that these things work in the patient, because that the information from our study brain CCO may prevent neurological decline with sick itself. And this is a human study. Gonzalez Lima. Protection against neurodegeneration. Low dose methylene blue near red light. I'm going to point out that using red light in these things, near infrared light, our devices use both always with red light. And the Neuroprotection is the mitochondrial health tablets that we use to a little bit deeper aspect of why this blue is important. So as we look at this, two neuroprotective just for enhancing mitochondrial respiration. Low dose methylene blue, this is an exogenous electron donor, cycler, boosting oxygen consumption and cell respiration, and molecular O2 reduced H2O. Low level red to infrared light directly energizes the cytochrome C oxidase, or photon absorption. Facilitate catalytic upregulation of cytochrome oxidase levels. These interventions result in long-term increases of cytochrome oxidase in the electron transport chain by a process of enzymatic induction that promotes oxidative metabolism in neuronal survival. So let's do it this way. Photobiomodulation works on the cytochrome C right there, or methylene blue works by pushing more electrons out, and the result is a higher push of electrons back into the tissue, creating more energy. In the conclusion, we describe two very physical chemical interventions resulting in a similar cellular mechanism targeting mitochondrial respiration. One entails fostering electron cycling by autooxidized redox chemicals, and the other using photon absorption near infrared. In vivo evidence from animal models of human studies suggests that low-dose methylene and low-level near-infrared light share a common mechanism of enhancement of microbial respiration, protects against neurodegeneration in a broad range of animal models of human neural disorders. We hope this fascinating approach targeting microbial will stimulate more human studies of potential application in neurology and psychiatry. This is 2021 human study treat Klein-Levin syndrome with intranasal photobiomodulation. Blue. Focus on this here. Klein-Levin syndrome is a rare neuropsychiatric disorder characterized by recurring episodes for some just fall asleep. Cognitive abnormalities such as memory loss and childlike language. There's no etiology for KLS. However, there are hypotheses of genetic predisposition, autoimmune mechanisms, abnormal thalamic functioning, etc. Similarly, there is no treatment for KLS as one method beneficial for one patient and not for one. Here, in the case of KLS, a patient who has no symptoms with a variety. Parents of the patient agree that the trial of intranasal powered remission of the KLS episode following with no further KLS episode reporting biomodulation, red, just in combination with blue. Now, 18 years old, patient experienced flu-like illness, actually the COVID, which triggered prolonged episodes of longer than typical duration, extended close to 6 months of this hypersomnia mental ability. The family has said on-label use of intranasal biomodulation with red light only, light 25 minutes in conjunction with blue 10 milligrams orally 1 hour prior to nasal or biomodulation. Now, significance that's Methylene Blue just before bed, and only 10 milligrams, and then they 25 minutes. Very similar to our, but we would. This is very interesting. You now have someone has extra sleep, so within one, she began to normalize mission of his hypersomnia, extra sleepiness, and of his cognitive behavioral. So after 1 month, patient family members noted the lack of occurrence of KLS symptoms or episodes, as well as a return to socialization rates. 6 months after starting PM Methylene Blue, patient enrolled in college. 20 years old, 2 years after the treatment, the patient has not experienced relapse of an episode, has been tested any other medications, nor has any adverse effects. Question: therapy or not? But prior studies have shown blue crosses the blood increases circulation via inhibition of peroxidase and decreased liquid peroxidation of inflammation. The idea that enhanced condition blue is not far stretched. Discuss blue medical function and decrease stress, which can improve neurons' effective function, their neurophysiology, and improve cognitive tasks. Have more brain flow. Human MRI studies have shown low dose methylene blue administration led to increase in activity bilateral insular cortex during its task, as well as enhancing using methylene blue and photobiomodulation in conjunction, may hold greater benefit for than using one method or the other. As discussed, both can help regulate cellular respiration in the mitochondria. Benefits of neuroprotection from degradation. Methylene Blue accomplishes this by increased cytochrome oxidase expression through supporting the electron transport chain. PBM directly energizes the cytochrome oxidase through photon absorption. However, it's important to consider for better response of methylene blue, as at high doses, you will elicit the opposite effect compared to low doses. Low doses of methylene blue responds to the increased cytochrome oxidase activity, while high doses decrease. PBM has been seen to have a similar relationship. Low levels, less energy, more time, induces an increase in membrane activity in the mitochondria, while the effects decrease at higher power levels. But it's important for one to refer treatments specifying those high doses to cause adverse effects. The regular, normal parameters of great. And again, this hormetic dose. And we see that both of these therapies. Now, the price of methylene blue is 5 to 7 hours. So you can take it twice, 2 times. 1 p.m., say at the latest. Methylene blue that we recommend does not have caffeine or stimulants. So you're not going to have any jitters or agitation. You will turn the color of your urine bluish to greenish. And this is a way to titrate to know how much is still in your system. So as the urine gets lighter in color, less greenness dose that. Very interesting and easily usable dosing. That means how much can you take safe? This is an excellent study of a novel approach combining methylene blue, photodynamic inhibition, photobiomodulation, oral ingested methylene blue, COVID-19 management. This is a pilot clinical study, 12 months management. It's a human study, oral biomodulation. Now, coronavirus caused by SARS-CoV-2 was first recognized in late 2019 and remains a significant. We therefore assess the use of local methylene blue photodynamic viral inhibition in the oral and nasal cavities, combination with systemic photobiomodulation, in combination with systemic antiviral, anti-inflammatory, antioxidant actions of orally ingested methylene and photobiomodulation for COVID-19 disease. Post-protocol leveraged the separate and combined effects of methylene blue and 60s red light diodes to comprehensively address pathophysiology sequelae in COVID-19. A total of 8 subjects with COVID-19 disease were treated in the oncology in a period between June to August. Very 1 month, 3 months, right? Using a remote care program developed this person. It was home care. Although not a prerequisite for inclusion, none of the subjects received any COVID-19 vaccination practices. Clinical outcome assessment tools include serial cycle threshold measurements of the surrogate estimate of viral load and serial online questionnaires that document response adverse effects. A 1-year follow-up survey to assess long-term outcome. All subjects received methylene blue to the target and the main sites of viral entry to the dose. And this was the central component of the treatment protocol, in addition with orally ingested methylene and neuroprotection. Mucosal surfaces were irradiated with 660 red LED continuous emission bulb flicker. Although subjects had significant comorbidities, extreme high viral loads, and moderate severe symptoms during this huge phase of the pandemic, the response to treatment was highly encouraged. Rapid reduction of the viral load was observed, and a negative PCR test was documented within a median of 4 days. These laboratory findings occurred in parallel with significant clinical improvements, mostly within 12 to 24 hours of commencing the treatment. Think about it. Their symptoms of COVID-19 improved in 12 to 24 hours, and their viral load was negative in 4 days. There was no significant adverse effects. No, this subject completed the protocol, went into the hospital. These outcomes were similar and encouraging because at 1 year follow-up, there was a virtual absence of long COVID symptoms or COVID-19 reinfection. Our results indicate that protocols may be safe and promising approach, challenging the COVID-19 disease. Moreover, due to the broad spectrum of activity, this approach has potential to address preparing and future COVID-19 variants and other infections transmitted via the upper respiratory tracts. Extensive studies are important. So this is the LED, very small, low-power LED device. They put it on the nose here, and they put it in the mouth. And this is the intranasal device. There's both red and infrared light. And this is the oral dose of methylene. This is another huge review on mitochondria as a target for neuroprotection. How does the role of methylene blue photobiomodulation come together? It's a human study looking. They did a huge review. The mitochondrial dysfunction plays a central role in the formation of neuroinflammation and oxidative stress, which are important factors contributing to the development of brain disease. Evidence suggests that mitochondria are a promising target for neuroprotection. Recently, methods targeting mitochondria have been considered as potential approaches for treatment of brain diseases, the inhibition of inflammation and oxidative. This review will discuss two widely studied approaches for the improvement of brain mitochondrial respiration: methylene blue and photobiomodulation. Blue is widely studied drug, potential benefits, effects in models of brain disease, as well as the limited human study. Similarly, PBM is a non-invasive treatment that promotes energy production and reduces both oxidative stress and neuroinflammation, and has garnered increasing attention in recent years. Methylene blue and photobiomodulation have similar beneficial effects on mitochondrial function, oxidative damage, inflammation, and subsequent behaviors. However, the mechanisms underlying the energy-enhancing, antioxidant, anti-inflammatory effects of methylene blue and photobiomodulation do. This review will focus on mitochondrial dysfunction in several different brain diseases and the pathological improvements following methylene blue and photobiomodulation. I'm going to show you a little diagram that shows the mitochondrial mechanism of action of methylene blue for memory and enhancement. Low concentrations of methylene blue exert antioxidant electron shuttling actions that support the respiratory chain. This is the same thing. More methylene blue pushes more electrons across the little membrane there, so you can push more of them back. Methylene blue photobiomodulation is there. A large body of evidence suggests the role of mitochondrial dysfunction in pathogenesis of several brain diseases. As a result, much attention is directed towards developing therapies for these diseases by targeting mitochondrial and cellular respiration. Methylene blue and photobiomodulation are two such therapies. Methylene blue is an FDA-approved medication which has been used as an effective agent in malaria treatment, methylhemoglobinemia, and cyanide poisoning. Recently, the potential of methylene blue to treat neurodegenerative disorders, ischemic brain injury, TBI has captured researchers' attention. Furthermore, beneficial effects on psychosis are reported in preclinical and clinical studies. In Alzheimer's disease patients and Alzheimer's disease animal models, cognitive performance were significantly improved after methylene blue treatment. According to a randomized, double-blind, placebo-controlled clinical trial, Low-dose methylene blue was able to increase function MRI activity during a short-term memory task, also improve memory retrieval. In addition, methylene blue has been tested in human clinical trials in which patients with mild to moderate Alzheimer's disease showed both cognitive and cerebral blood flow improvements. Potential therapeutic role of methylene blue for neurological disorders may result in transformation between the reduced and the oxidative forms. During this process, methylene can easily cross the blood-brain barrier, donate electrons from the reduced form to the mitochondrial electron transport chain, thereby increasing consumption, ATP production, more energy. In clinical studies, patients with mild to moderate Alzheimer's disease took methylene orally, 60 milligrams, 3 times a day for 24 months, showed patients had an 81% reduction in the rate of cognitive decline after 50 weeks compared to controls. Pretty amazing. Not to suggest the beneficial effects of methylene blue on Alzheimer's patients was linked to the prevention of this tau aggregation, more energy in the brain. In addition, methylene blue has been suggested to direct interact with the mitochondrial electron transport chain as catalytic redox liquid, carrying electrons into complex 4, helping cytochrome oxidase produce more. During the conversion, methylene blue and its reduction counterpart Nico access of neural S is reduced by bypassing pathologic blockages in complex 1. Methylene blue is also known to be able to enhance the activity of complex 4, and as well as upregulate heme synthesis and promotes mitochondrial function. In addition, it stimulates complex 4 activity in normal cells. Mitochondrial potential is increased above baseline levels, resulting in increase and rather modest increase in ROS production in the short burst. ROS is cumulative active cytoprotective ROS into damage. Here's the underlying mechanism. You know the about this is for methylene. Primary mechanisms is it cycles these electrons across the inner membrane to that little intermembrane space, this level, these levels here, which allows more hydrogen electrons to pass through here on cytochrome oxidase to make more ATP. And the same sort of mechanism underlying mitochondrial protection through PBM. It's called a nitric oxidative associate causing the complex to increase, complex 4 here, which pushes more electrons through, giving us the character, thereby boosting cellular energy levels, creating more. This is a summary of the effects of PBM or methylene blue on neurodegeneratives and brain disorders. These are the references here. You can see that there's similar effects in treatment with methylene blue or with photobiomodulation. Alzheimer's disease, traumatic brain injury, stroke, depression, Parkinson's disease. So they really looked at this in depth, and all the references there. You can see there's 300 references. And in summary, both of these therapies, methylene blue, photobiomodulation, stimulates mitochondrial cytochrome oxidase metabolism and oxygen consumption. And low dose methylene blue prevents superoxide radical formation, less free radicals, reduces that oxidative stress to potent antioxidant, it's antimicrobial for the gut, increases brain oxygen consumption, improves memory, has a significant therapeutic effect on learning and memory. And methylene blue and photobiomodulation have similar beneficial effects on mitochondrial function, oxidative damage, neuroinflammation, and subsequent dosing. This is the one that we recommend, NeuroPro, funny how it's the same as ProNeuro. It's maximum strength, nutritional support for mitochondrial brain health. So 2 pills will give you 30 milligrams of methylene blue. And that's great. Maybe you can do it more. You only have to swallow these pills with water. Don't chew them. Don't sting. They go right inside. Made in the USA. And it has little vitamin C. Most of the science studies, Francisco Gonzalez Lima name involved, all of one of the benefits you can see, and you can see this both with photobiomodulation or with the NeuroPro help depths or the Pro Neuro photobiomodulation device, enhance mental clarity, increase focus, chemical science and cognitive function, high quality stuff, science facts to elevate your performance. So each pill has 15 milligrams, so that's the lowest dose really that you can really take out there, right? That would be very low, and it's maximum strength. It's pharmaceutical grade. You don't have to chew it. It's not going to stain your teeth or counter spills. It's designed to be swallowed, and that's why we say using these two together is probably the best way to restore cognitive function in the brain, improve brain injury, more photobiomodulation, more brain power for all. Thank you.